This is our presentation on medical racism, and I'm Detravian Bro.
I'm Zakis Riley.
I'm Aloma Mbue. On my slide, I will be talking about the Tuskegee Experiment Project, which is originally called the Tuskegee Syphilis Study of Untreated Syphilis in Negro Male. It was an experiment that was originally designed to record black people having a long-term disease of catching the syphilis infection that has been untreated for a long time. And the whole study involved 600 African American male with the half of 399 of them catching the bacterial infection, and the other 201 who did not catch the disease. And it was recorded that hundreds African American black men have died from said experiments. This all started around in Tuskegee, Alabama during the 1930s and throughout the 1970s, where the government, or specifically the United States Public Health Service and the CDC, which is the Centers for Disease Control, have started the experiment just to study black people, but also by working with the Tuskegee Institution in order to study and use black people as subjects for the disease. And doctors and physicians have believed that the disease, syphilis disease, attacks black people, specifically in the cardinal vesicular systems. And black people who were used as test subjects, like getting their blood drawn and getting needle shots, they were told that they will get free promises of free medical benefits, which was false, as the whole experiment was terrible, and also it's instead of making them better, it started affecting them badly, giving them worse medical health than their white counterparts, and things turned for the worse for them. Even though the government and the scientists knew that it was turning bad for them, they still went with it regardless of the risk of them infecting other people, and also suffer from other diseases such as other effects such as blindness, mental illness, and heart diseases. The impact of this is because of the failed experiment that African Americans have grown not to have trust in public health professionals or even taking medical vaccines, even though they seem too good to be true. And because of the study, black patients have suffered even worse, as I said before, worse outcomes than their white Caucasian counterparts people. And also, it was also terrible since the researchers did not get enough consent from said subjects, or did not even provide enough treatment when available for the patients. And also, the government and scientists have assumed that black people were prone to catch a disease more than other diseases, and also catching it way faster than other races can. And these pictures are here talk that shows the real events of the Tuskegee experiment study that happened in Alabama. As you can see, they were getting their blood drawn and also getting needle shots to check if they have any syphilis or if they did not have it.
So next, we're going to talk about the dark history of the vaginal speculum. Um, the vaginal speculum is a medical instrument designed for examining the cervix and the vaginal canal, and it was invented in the early 19th century by Dr. James Marion Sims, an American physician. Um, he's accredited with the invention of the century and made a lot of money from that invention. Prior to Sims, there were earlier prototypes of the specula, but the design significantly improved through the instrument's functionality through Sims. Dr. James Marion Sims conducted experiments and surgeries related to gynecology on enslaved women. Um, he is known for performing his experimental surgeries, such as the vascovaginal fistula repairs on enslaved women without their consent or without anesthesia. Sims' unethical practices highlighted a troubled aspect of history of gynecology, where medical advancements were often made at the expense of marginalized and vulnerable populations, including the suffering of enslaved women, in the name of progress, medical progress, for white women. Enslaved black women were often subjected to non consensual medical experiments and surgical procedures and gynecological research during the area of slavery. The exploitations contributed to the development of medical knowledge and advancement at the expense of black women's health and autonomy. The father of modern day gynecology, uh, Dr. James Marion Sims, often conducted numerous surgical experiments on enslaved black women without anesthesia, without their consent. His work is celebrated in the history of medicine, but it also exemplifies the systematic racism and dehumanization experienced by black women in healthcare. Discrimination and disparities in healthcare, even in the post-slavery era, black women have faced systematic discrimination and disparities in healthcare, including unequal access to quality medical care, high maternal mortality rates, and the enduring legacy of past medical injustices. These issues reflect the ongoing impact of medical racism on health and the well-being of black women. So here we have an actual kind of like an example of how an enslaved woman would look whenever they were doing experiments on her. These are actually at the bottom here, the first types of examples of the vaginal speculum, and you can kind of see how they kind of evolved over the years. And they look pretty gnarly in the beginning of the year. Of course, we have here at the top right corner the end product of the modern day vaginal speculum, and wanted to include a diagram in there just to show the fellows on how this kind of works. And really, just the audacity of this entire device here is really just, even though it has led to a lot of help, a lot of good for women in general, it was really barbaric in its construction and its beginning phases there. So, just wanted to add that in here. And that's it.
Okay, next we're going to go over some more examples of medical racism. So, according to the CDC, in 2021, the maternal mortality rate for black women was 69.9 deaths per 100,000 live births, making them 2.6 times more likely to experience this than white and Hispanic women. This is a result of historical and systemic discrimination over time, which includes severe damage done to the bodies of black women by oppressors, which includes physical abuse, sexual abuse, also denial of housing, lack of general education, specifically sex and birth education, and constant rejection of employment, and finally, inaccessibility to medical care. These stereotypes of pain tolerance also plays a part in this and gives an answer for the disproportionate rates of maternal mortality amongst black women. Lack of insurance was a problem for 20% of African Americans during the height of COVID-19, which led to many not being able to get treatment or afford medication, according to the PMC. These also, along with this, pre-existing conditions in the black community, such as high blood pressure and other heart-related illnesses, made it even harder for those infected by COVID-19 to recover. The impact of mental health due to stress, anxiety, and grief throughout COVID-19, as well as the inability to access mental health, not only created more medical problems, but extenuated the already existing ones. The black community made up approximately 13% of the workforce during COVID-19, but take up 19% of jobs that were deemed low-wage frontline essential jobs, which include nursing assistant and home care aide jobs. This put the black community at the front of the pandemic, but left them with the least amount of resources to defend themselves with, according to the NCBI. The black community, specifically black women, have been stereotyped on having higher level of pain tolerance compared to white counterparts for centuries, which we have highlighted earlier in this presentation. The idea of black skin is thicker than white skin was used to justify acts of slavery and and created even higher rates of chronic diseases such as hypertension, diabetes, other heart-related illnesses in the community. Mistrust of healthcare as a whole from the community was a result of this, and which potentially leads to reluctancy in seeking medical care, abiding by the treatment plans given by doctors, or denying and possibly denying participation in clinical trials and medical research. Experiencing medical racism could lead to long-term decline in mental health, increase of anxiety and stress, and ultimately the deterioration of health in general. Medical racism also impacts future generations by allowing distrust in the medical field to continue, which creates the space for untreated illnesses and diseases, and as well as systemic inequalities as a whole to be passed on.
And this concludes our presentation on medical racism. We learned that from the very beginning of America's history, Black women have been used as experiments, as subjects, and as dehumanized objects to be worked and experimented on for the betterment of white women and the white population.
And the Tuskegee Project also shows that the government does not care about Black people, and that Black people will be used as experiments and subjects and will be given false hope.
After this presentation, you should be able to see how important the conversation of disproportionate rates of maternal mortality is, as well as the effects that COVID-19 has had on the Black community and the long-term effects it will leave behind.